All right, guys, happy Tuesday and welcome to episode 1 of Leaders 30. My name is Khan. I am the president and the lead provider at XL Medical Spa in conjunction with Dr. William Trusnovic. And we're excited to bring that very first episode of Leaders 30. So the intent behind Leaders 30 was for you guys to get away from listening to me talk, because everything has been from my standpoint, my viewpoint, my educational pieces. What I wanted to do is bring on other content experts, people I've met in the field, people who are experts within their field, whether skincare, injectables, another physician, a plastic surgeon, whatever the case is. But I want to bring them on the second Tuesday of every month, and we're going to talk about a topic. So today's topic, which you've seen on the top of the screen, is why do we suck about skincare? So the guest I have today his name is Lance. I've known him for a couple years. He has about 10 years in the medical field. He's also owned his own pharmacy in the past, but now he currently works at one of the largest and up and coming medical skincare companies in the country. So I'll mention a little disclaimer in a bit, but let me bring him on first and then we will chat as well. So give me a second, guys. All right, we're waiting for Lance to come on. There he is.
How's it going?
Good. How are you, Lance?
I'm doing well.
So a little introduction of Lance. I met Lance, well, first disclaimer. Although he works for one of the largest, one of the fastest rising medical skincare companies in the country, he is not representing them tonight. He is representing Lance, my friend, my buddy, and also a skincare expert as well.
Perfect.
So if something slips, he doesn't represent that company. But I met Lance probably 2 years ago at one of the old med spas that I worked at. He came in as the skincare representative, and he was bringing on a new product for us. And if you know aesthetics, or if you know the realm of skincare in general, a lot of it is represented by women. So when I saw Lance coming in, talking to us about skincare, two middle-aged men talking about skincare, I mean, if that doesn't scream content expert, I don't know what does. But he came in, he spoke from a scientific standpoint, just really refreshing when it came to his standpoint on skincare. But that's how I first met Lance. We became friends. We've hung out outside of work, and I've really leaned on him as a content expert, and really he's helped me open up the facility up in Orange County as well. So welcome, Lance Ramsey.
Thank you for having me.
Yeah, thank you. Thank you. So the title of this is, why do we suck at skincare? And when I say we, I think of it as a lot of the clients that I meet. And then also, I think in the American culture, there's still a lot of misconceptions and a lot of things about skincare that we don't understand. So I'll open up that question first. Why do we suck at skincare? Either you can agree with it, not agree with it, but I want to hear your side first.
No, I agree. I think skin is the parts of our body that's left out. It is our largest organ of our body. And I wave too. I don't know how to do that. It is our largest part of our organ. I think the simple concept of hydration is key. So hydrated is really, truly proper skin. Of course, creams and lotions, that helps as well, but the staying hydrated. I think also there's a lot of misnomers out there. There's a lot of noise in terms of the industry of what to use. There's commercials you see that tell you to use one thing, other things. But I think the foundation of skincare starts with three things. Antioxidant. I think those three are going to key and make proper nutrition.
Yeah, I think you actually beat me to the punch right there. That was actually one of our questions later. So we'll come back to that right now. But going back to your answer of, it might be a cultural thing, or we'll talk about why there are some things. Why is there such a big barrier or a big gap into us using skincare? But from a cultural standpoint, why do you think that is?
Well, I think maybe, in terms of proper skincare, a lot of it's education when we're younger. UV rays, staying out of the sun. We're taught at an early age, oh, let's go get a tan. Let's get our skin nice and tan. It's going to look nice, and that's going to really deteriorate our skin health. And in terms of that, just the education is brought on later on in life, like middle-aged men. Now we're thinking about skincare, right?
Absolutely.
I tell you, when I was 14, 15, 20, I wasn't thinking about that. So I think there's a gap. Once we see things happening, then we're looking to correct. I think essentially why skincare is neglected. And I think the matter is shortening that bring proper education to those that don't see damaging effects yet. Because when we're young, see wrinkles, see sun damage, it's under the surface, but necessarily it's not exposed. So I think this is really what's of us not really thinking of skincare until later on in life.
Yeah, I think one of the singular things, well, granted, you mentioned water, but I'm having my apple juice for the day. It's like one of those long days. But Tuesdays for me is from 8 to 5, just virtual consults all day long. So ending the night with some apple juice. So sorry, Lance, no hydration right now.
It's okay.
But so in America, we used to value like the very light skinned, like 50s, 60s, and 70s, all about staying out of the sun, right? Having the pasty white skin gave you a certain persona. Whereas if you go to Asia, same thing. If you had white skin, it gives you a certain persona. Whereas on this side of the world, Latin America, we value that tan skin. When we were younger, when we tried to look fitter, look a little bit slimmer, we would get tanner because it played a little visual trick to give us a little more tone and definition until we got to our 30s or 40s or 50s. And we're like, man, a lot of damage on our skin. So I think you're right that culture does play a role in it and how we perceive beauty.
Yeah.
But on our side of the world, that beauty, when it turns to 30s, 40s, and 50s, it really flips and it does a lot of damage to you.
Absolutely.
So let me say one of the things that I mentioned in regards to barrier is the cost factor.
Mm-hmm.
For me, because I co-own a facility, because I'm very all-encompassing when it comes to aesthetics. It's not just what we do in office. It's not just Botox. It's not just fillers. But if you don't maintain those results at home, I see you once a month. I see you once a quarter.
Absolutely.
But what are you doing in the meantime to really either one, maintain what you progressed in office, or two, how are you going to continue to correct that? So how do you reply to a person that says, I can't afford $200, $300, $400 on skincare. I can't rationalize that to myself.
Yeah, that's a great question. You know, in terms of maintaining proper skincare, relaying, talk about injections and wrinkles, I think proper hydration of a really rich moisturizer is key. Having a moisturizer that has hyaluronic acid is key. As we age, we lose the plumpness. So our body produces HA, hyaluronic acid, naturally, but as we age, it depletes. So I think it's important that when we look for hyaluronic acid, lipids, and rich ingredients that really help, that proper maintenance, especially if someone is getting injections between injections.
Hey, Kavita. Hey, Lance. Or, sorry, she was saying hi to Lance.
Oh, hey.
Yeah, so I know, like you said, so cost plays one role, but really understanding the ingredients, right?
Yeah.
Or if we'll go to over the counter next, but if you go to any department store, any just brick and mortar store, and you see 3 aisles worth of skincare, it's really hard to discern, am I going to get XYZ product? Am I going to get a name brand? Am I going to get a designer brand? And a lot of times that drives our skin health. And what people don't realize is it's not just a brand where you can put on a shirt, put on a pair of jeans, and it's a fashion style. But when it comes to skin, it's really health. It's almost like a medicine. And if you get prescription strength, medical grade, that is a medicine. And if you wouldn't put a generic or a over the counter, or if you had an illness, you wouldn't just buy something off the street and say, here you go, let me take the best. But I think that's the knowledge gap between a really good skincare that's actually going to correct something for you versus just a moisturizer. It's just going to moisturize and do nothing else. Doesn't correct you, doesn't anti-age you, doesn't protect you. So all those things play a role.
No, I agree completely. And I think to shorten that gap and to see a professional such as yourself too, help shorten that gap, because as a consumer, going into a department store, pharmacy, trying to see what the proper nutrition is for skin, someone like yourself can really help guide them to the right direction to see what they need to exactly what they're looking for.
Yeah, when I first met you, and granted the facility we were working at the time probably had 6 different skincare items, right?
Yeah.
So as a consumer, when you walk in, it's like walking into a department store. What do I buy? What is good for me? And what I liked about you was, because we both come from a very scientific background, it's why is this product so much better? But not even that, because you weren't trying to get rid of all our other SKUs, but keep your SKUs, do what you want, but try it. XYZ, these ingredients, these products is what's really going to help you.
Absolutely.
And because you gave that foundation, you gave the science behind it, then it gave you more credence.
Yeah.
We've done a lot of events together where I'll see patients first and I'll do their procedures. But at the beginning of it and the end of it, we always talk about skincare.
Yeah.
And then oftentimes I would send them to you and you would give them more of that formulation and how to really maintain those results. And at the end of the day, they become a believer.
Yeah.
Because yes, they can try it, but in the 3 months that scare has been working, if it doesn't work, you've lost them forever.
Yes.
So it's really building that rapport and that trust as well.
No, I agree. Us as two middle-aged men, we don't look middle-aged, so that helps as well.
Yeah. And one of the other podcasts that I listened to is called Milk Tea Mondays. They actually mentioned it a while back. I think it was 2 episodes ago. Check out Milk Tea Mondays with Jen Chung. But she was talking to a physician, and she said, would you go to a dermatologist who had uncontrolled acne? So it's kind of like when we look at you or people look at me, one of the common things they say is, I want your skin. How do I achieve that skin? And it's really that foundation that you build at home. It's your morning routine, your night routine, your hydration. What products do you put in you? What products don't you put in you? That really makes the difference.
Absolutely.
Let's go. How about this one? I don't have the time. How would you respond to a person that says, I'm way too busy, I have 5 kids, now with COVID, I have to wake up early in the morning, get my job on the way, but then also have to get on the Zoom with my kids for their schooling. So how do you respond to the person that says, I just don't have time for it?
Well, I hear that a lot, the mindset, right? So just think they have time for caffeine, driving to start. It's the mindset. So train your mind what you want to achieve. So let's say if someone has pigmentation or acne, whatever you want to tackle, I think it's making time for it. Just like if someone wants to lose weight, they go to someone wants to have good skin, they're going to use the proper ingredients and nourishment for them. So I think it's more of a smoke screen. I don't have time, but more so it's a mindset that they have to get out of to create that time. Just like brushing, I want to have clean teeth. If we're like, oh, I don't have time to brush my teeth, then all the teeth are going to fall out, and a lot of dentists are going to become extremely wealthy, doing it. So I think it's more of a mindset, and using rich ingredients, they're going to see results. And I think that's going to help them create the time, just like as we brush our teeth are clean. So we want to keep doing it as well. So I think it's more of a smoke screen that you have to change the mindset of.
Yeah, that's a good analogy. It's like anything else. If you choose not to do something, that's fantastic. But you shouldn't go into a trainer. You shouldn't go to a dentist. You shouldn't go into a medical setting and cause all this damage and then have that expectation that they're going to correct that damage.
Yeah.
So it's really what you're going to do at home. And I guess we can segue into this because Jen asked, what are the core products you need for a simple skincare routine? And this actually came along online too, where they asked on Instagram. Let me pull that up. So the similar question, what single product would you recommend for those in their 20s, 30s, and 40s? So skin is different for everyone, completely understandable. But if you were to lay a base foundation that everyone should at least be on, what would it be for you?
That's a great question. So in terms of proper skincare health, I mentioned earlier the 3 essential factors: SPF, protecting the skin from environmental factors, blue light, etc. Then you have an antioxidant, which helps bring the skin back to proper health and skin as well. And then you have a retinol, third product, which helps with the aging portion to renew the skin cells. So I guess what is the particular person looking for? Let's say if they're looking to eliminate fine lines and wrinkles, I would point them in the direction of a retinoid. Let's say if they lead a really active lifestyle in the sun, definitely an SPF, because the protection of the skin, especially at an earlier age, is going to help prevent the degradation of your skin and also aging factors that create wrinkles. So it's kind of a loaded question because there's a lot of answers depending on what the person's looking for. Or to limit it to just one product, I would say SPF, because the sun can really damage your skin, especially if you start young and protect your skin. We all see a lot of the actors or actresses that are in their 50s and they look like they're 30. And you could tell they really haven't had any work done on their, but they protect their skin from the sun, environmental factors at an early age. And I think that truly is extremely important, having the proper SPF to use.
Yeah.
More not a chemical, but a physical SPF, which is more zinc titanium dioxide.
Perfect. Yeah, I wish we had more time in this and to dive into the individual stuff. But one of the things that you mentioned is a common thing I get asked very often is the retinol, retinoid, retinoic acid. So let me come back to that really quick. Don't let me forget that.
Okay.
But so this is the spiel I give my patients or my clients. When they first come into me, whatever the case is, I get their back history. And then the first question I ask them is, what is your skincare routine? What is it at the daytime? What is it at night? And whatever routine they give me, I'm not trying to alter or change their routine, but I'm trying to get an understanding of, are you doing the right things? Because if you're not, then we're kind of backtracking.
Yeah.
So for me, it's AM, PM, base and simple to answer the question of what's the basic routine. So daytime for me is do everything to protect yourself. Antioxidant, SPF, and then whatever else you want to put on. But those are the two main things I recommend to people, antioxidant and SPF. Just protect yourself.
Absolutely.
At nighttime, that's when you want to correct. So you've done everything during the day to protect your skin. Now at night, how are you going to correct everything that you caused damage to over the years? So for me, it's a glycolic acid face wash and then a retinoid or retinoic acid. So that's the basic simple for me. Once you get that down, we can always add products in the future. But that goes back to the I don't have time, or that goes back to I don't know what to use, or I hear so many things. But as long as you get those basics down, your push-ups, your sit-ups, you can add the squats, the jumping, and all those things in the future.
Absolutely.
So now I want to get an understanding from you. So when someone tells me retinol, when someone tells me retinoid, retinoic acid, retinoid, how would you explain to just the normal consumer what's the difference between all those items?
Absolutely. That's a great question. So the way I would explain it, so you have the family, the main thing at top, and that's a retinoid. So retinoid can be branched off into things. You have a retinol or a retinoic acid, aka tretinoin as well too. So those are terms for retinoic acid, tretinoin. That's all the same group. So the retinol needs a conversion. So it takes a 3-step conversion to become retinoic. So our skin only recognizes retinoic acid. So in order for our to turn over properly and for us to have the benefits of a retinol, it has to become retinoic acid. So there's a conversion process. Now, going over to the other side with tretinoin, retin-A, or retinoic acid, there's no conversion that's needed. That is the purest form that our skin's going to recognize. It's going to utilize immediately. Retinols, that probably takes up most of the marketplace that you're going to see that's over the counter. And on the right, the retinoic acids and tretinoin, that's going to be a lot of the professional grade, prescription grade products that you're going to see, especially from a provider like Khan. He'll be able to have those tools that they could give you. And usually the results are much quicker than retinol, because retinols are not an exact science. The way it's converted depends on the patient's skin, the enzymes. So there's not an exact science behind it of how strong or how much efficacy, how much you're going to see in terms of results for the other side of retinol.
Gotcha. One of the things that I think it helps me remember, you can tell me if I'm completely way off on this,
yeah.
But retinols come from mols. Is that correct?
I haven't heard that, but yeah.
Am I right in saying that? And
yeah.
then retinoid, retinoic acids, those are more of your prescription strength, and then retin-A is, retinoids, retinoic acid is your medical grade, and then retin-A's are your prescription.
Yeah, that's right.
Yeah. I forgot who told me retinols come from mols. I'm like, okay, I'll go with it.
That's a good one.
So before we get past this question, one of the questions is, what skincare brands can you recommend? So in our office, we really only carry 2 brands because everything that I carry, I have to believe in. So if you go on our website, I don't want to promote any singular brand on this topic right now, but you'll see what brands we carry. We only carry pretty much 1 sunscreen, and we carry 1 major medical grade skincare company. Because once again, if I have 6 lines, it's going to be difficult for me to try to give you a spiel on why all 6 brands are great for you. And if I'm not using all 6 brands, then I'm your test dummy, I'm your test case. So for me, it's find a brand that you believe in. Try to find medical grade, because usually they have to have research to back their findings. Where over-the-counter brand or a private label or a celebrity brand, they can just slap on a label and call it a day. But that's for me. Find a medical grade that works for you. Find a provider that can speak to you in regards to why you should use these specific products. And then if they're starting you with a foundation, 3-4 products, good to go. If they're trying to sell you a basket full of 7 products, then you should probably question why you should use all these things. Do you agree with that, Lance, or do you have anything to add on that?
No, I agree with that completely. I think the key thing is when going to see a provider, really kind of consciously making a list of what is it that you want to tackle. Because I never recommend starting on 7 products at one time, 5. I recommend, just mainly seeing what you're using currently, what's not working, to take out of that regimen, and what you want to add. And are you happy with the results? Because let's be honest, there's a market, and a lot of them, we just get in our routine and we're not seeing the results. We're so used to using them, and we just settle for it. It's important to really patients for yourself to see what it is that you desire and what results you're looking for, and then kind of tackling it that way. But yeah, with Khan's statement, I would definitely never 7 products at a time. I would just start with a few at most.
Yeah, some of the viewers that we have right now are my personal patients, and we've dealt with acne, dry skin, oily skin, and all those items. And it's really, they have to believe what I'm doing for them. So once we built them on that skincare, if it doesn't work for you, if you start with 10 products, right?
Yeah.
And it dries you out, or it gives you acne flare up, or you have like irritant dermatitis from it. If you start with those many brands, you don't know what caused it.
Yeah.
Whereas you're starting with a minimal amount, then you can fine tune and say, oh, my skin did not agree with that, or my skin loves this. So that's another reason why to start with the foundation.
Absolutely. No, I agree.
One of the things I commonly get, especially now in the realm of IG, in the realm of these podcasts and all these influencers and educational people, where would you point a person to really get good education and the right education when it comes to skincare brand or skin type or how to take care of your skin?
No, that's a great question. So a lot of education would be taught from professionals such as Khan, a dermatologist, anybody in the aesthetics industry. Some estheticians can also be a great resource. But I think primarily making sure that the professional lines up with how you communicate, I think that's huge. But there's a lot of pieces online as well that you can find, but I would say probably the best would be from a professional such as Khan, our short-winded answer.
Yeah, because if you think of it from a medical standpoint, if you just looked online and you looked at the Mayo Clinic, you looked up WebMD, and you just said, I have a cough, you're going to get all the spew of education and you don't know what to take or why you have that cough. Similarly, if you had acne, right? There's hormonal acne, there's adult onset acne, there's there's ovarian cyst acne because it plays with your hormones, birth control. So there's so many different reasons why you would get a specific concern for your skin. So yes, you can get general education, but if you go see a doctor, you see an esthetician or a general provider, they can really hone down and tune in as to why you're having that cause.
Yeah. No, I agree. I always refer to as Dr. Google.
Yeah.
I'm sure you've seen people come in, there's always people and the Dr. Google say, this is why it's causing this. But my recommendation is to have an open mind when seeing the provider to really kind of pinpoint what might be the cause of something that you're experiencing, and they could really direct how to correct it.
Yeah, and this is part of why I kind of came up with this concept of Leaders 30 is because I'll do YouTubes, I'll do IGs, but once again, that's just from my opinion or my professional background. Doesn't mean it's right, doesn't mean it's wrong. It's just what I've learned, and that's my educated guess. That's my assumption what will work for you. But if I bring on people like you, I bring on a doctor or someone else, they can either say, yeah, I agree with you. No, I don't agree with you. But we can have that banter back and forth and really have that understanding and give our clients a better understanding of what we're doing.
Absolutely.
Let me see. we only have 5 minutes left. So let's do this one. How about who should use over the counter? Who should use medical grade? Who should use prescription strength? Or what's your opinion between the three categories?
So that's a great question. I think it all depends on what the patient is looking for. Of course, let's say if someone has severe melasma, that's hyperpigmentation. Of course, going to a dermatologist is going to be best to see really how they can combat it. But let's say if someone has like little age spots here and there, I think a prescription grade product would be great. So it depends on levels, and to be, or sorry, not prescription, but like a professional grade. I think varying levels are going to be determined on which way they go. But in terms of my viewpoint is like, I believe that most professional products are going to be over the counter. So I would always direct toward professional. So going to see a prescriber such as Khan is going to be the best bet, because they're going to really give you a product that's going to work a lot quicker. If you think about it, over the counter, there's hundreds of companies that are rushing just to put a product on there. There's no data research. They're just putting products in a container and really using the name behind it that propels the sales and commercials. Going to see a provider such as Khan that is going to have all the scientific for the product, see these actual results in his practice, where he could apply that specifically.
Yeah, you brought up a good point, and it just made me think about it. I never thought about this before, but when you do like a medical grade and you go to their websites, you'll see before and afters all day long. Before and afters, 12-week trial, 16-week trial. But if you go to a celebrity brand, a name brand, all you see is a model, an influencer who's been airbrushed. Rarely do you see this is your beginning point, this is your pores, this is your wrinkles, this is your puffy eyes. And yeah. I never thought about it that way, but if you want results, you probably want to see how that product works for the common consumer. Sure, everyone can look fantastic if you're airbrushed, right?
Yeah.
So yeah, that's really a good point when it comes to distinguishing over the counter and medical grade. All right, I think we addressed everything. Obviously, there's always a lot more to talk about when it comes to skincare, and I want to address this question, but I'm not going to bring it up this time because next month we're going to have a specialist on. But the question was adult acne versus teen acne and the scarring. What are good products to use? So we'll mention that because I'll have an esthetician probably come on next month, talk about acne and adult acne, but I want to make sure I didn't forget the question. Let's close up, Lance. So before we end, is there anything you want to say specifically on why we suck at skincare, or what do you think about the topic?
Well, I think it's a great topic. I think mainly education starting at a younger age is key. 12, 13, 14, 15, sun care health, I think is essential. You know, teaching kids to really protect themselves. It's going to create, you know, people that have better skin at a later age. And, you know, it might put you out of business if we start taking care of skin early.
Yeah, true. That's true. But people talk about that about hospitals. If we do preventative care, then no one's going to go to hospitals. That fear has been around forever, but that doesn't work.
No, but I think
yeah.
Great job.
Thank you, man. I appreciate it. I appreciate you coming on the very first episode of Leaders 30. This has been highly informational.
No,
so hopefully hopefully the clients like it, and then our audience likes it too. I think this is really helpful, especially in regards to medical grade versus over the counter. This has really been helpful.
Thank you, Con, for having me. I enjoyed my time here.
Thank you. Yeah, I haven't seen Lance since quarantine.
Yeah.
So I think it's like January, February. It was the last time we either hung out or played basketball together, or when he came to one of the practices. So this is the first time I've seen him for a while.
Yeah. I lost 27 pounds. You might not recognize me.
There you go. Yeah. Well, we'll talk about that later. Too much volume loss is going to make you look old. So you might have to come in soon.
Yeah. True.
All right. I appreciate it. Okay.
No problem. Take care.
All right. Stay safe. I'll see you soon.
You too. Bye-bye.
We'll let Lance sign off. Hey guys, so that is the very first episode of Leaders 30. I appreciate everyone who signed on. Kavita, I miss you. Hopefully you're staying safe in Southern or Northern California. Jen, Ari, I appreciate all you guys signing on. And everyone else, I appreciate it. So that is the very first episode. We will do this again next month. Remember, it is the second Tuesday of every month. We're going to bring on a new leader, a new content expert. And then everyone, please stay safe. There's a lot of fires going on down south, and especially during COVID as well. Just please stay safe. I'll see everyone soon, okay? Talk to you guys later. Bye.